you so much, everybody, for joining. We have in today's call, we have Adriane, who is here to talk to all of you, all our nurses, and also in general. She's going to share her experience. She's working in an elderly care center with dementia and Alzheimer's patients. So you can ask all of your questions to her about life in Germany, working conditions in Germany, nursing specific questions also you can ask. So please feel free to do that.
Can I just make a couple of requests? Can I get everybody to be on mute? I think I would like to I'll ask Adriana some questions to begin with. I'll translate because she'll be speaking German. And then we'll open up the floor for questions. Gayatri, what do you think? Type them in or hands up? How should we?
Type your questions. I think that'll be better. You can type your questions in the chat section.
Type your questions in the chat and then we'll go through them, and that's probably the easiest way to do it. And then yeah, so Adriana has been in Germany for a very long time. She's from Brazil, actually, so she's not from India, but she's from Brazil. So she's done the journey. She came to Germany. She started up her life here, and she's what we call an angelernte Kraft. So she started learning on the job here. That's how she got into nursing. She worked for 16 years in a elderly care home and is now working in a it's called a WG. It's a home, basically shared accommodation. So there's but it's focused on dementia. So they've got, I think, 15 or 20 people living there who have dementia, elderly care. And she's been working there for, I think, 10 years. Adriane, wie lange bist du schon in der Demenz-WG?
Auf die Demenz-WG bin ich 3 Jahre fast.
Okay, 3 Jahre. So she's been there for 3 years now in the Demenz-WG, but she was 16 years in the elderly care home before that. So maybe, Adriane, you can tell us a little bit about how you learned German. Wie hast du angefangen, Deutsch zu lernen? Hast du einen Deutschkurs gemacht? Wie hast du das gemacht?
Ja, ich bin nach Deutschland gekommen als Au-pair-Mädchen. Ich lebe bei einer deutschen Familie. Vormittags habe ich auf die Kinder aufgepasst und nachmittags bin ich jeden Tag zur Schule gegangen. Und da habe ich 6 Monate lang einen intensiven deutschen Kurs teilgenommen und da Deutsch gelernt.
Super. So she came to Germany as an au pair to begin with. So looked after the kids in the morning, and then for 6 months she did an intensive German course in the afternoons. So you see, actually 6 months is pretty compact, actually, to get to a very good German level. So that's really good. Obviously, Adriana was in Germany, so that does make a difference. But when you focus and you learn it, you can learn it pretty quick. And Adriana, maybe you can tell us a little bit, vielleicht tell us a little bit about your job at the Demenz-WG. So erzähl uns ein bisschen über deinen Job in der Demenz-WG. Was machst du von Tag zu Tag? Wie ist es da?
Ja, unser Hauptberuf, sagt man so, ist natürlich, die Bewohner zu pflegen. Ne? Und weil das 11 Bewohner pro Etage sind, wir haben genug Zeit, alles mit viel Ruhe. Und bei uns dürfen die Bewohner machen oder nicht machen, was sie möchten. Zum Beispiel, wenn jemand morgens jetzt bis 11 Uhr schlafen möchte, dann respektieren wir das und versuchen so in die Rhythmus von der Bewohner zu pflegen. Ne? Und natürlich, wir versuchen uns mit den Bewohnern viel zu beschäftigen und was zu unternehmen auch. Ne? Aber das ist jeden Tag anders auch. Ne? Wir müssen auch in die WG ein bisschen Hauswirtschaftsarbeit machen. Ne? Wir haben eine Köchin, die da kocht, aber zum Beispiel wir müssen mit die Wäsche auch uns beschäftigen und ein bisschen aufräumen. Wir haben natürlich Reinigungskräfte auch, aber das gehört alles dazu. Wir sind bei denen zu Hause.
Okay, so maybe you understood it a little bit for you guys who are a little bit further in your German. So Adriana comes to work, and they've got 11 people living on 2 or 3 different floors. So they don't have. Some homes have more patients, I guess, but in this case they have fewer, so they can really focus with a lot of time and care on each of the patients. They respect the timeline, the time frame of the patient. So if one of them sleeps till 11, then so be it. That's okay. They do a lot of excursions with them. They go outside when the patients, where possible. If someone is able, they go outside. I know that they go to the ice cream shop once in a while and things like that. So they go out. What also is part of the job, so obviously the care of the patients is primary. They have a cook in this place that cooks, but they also help out with the washing of each of the elderly people. They help out with the general cleaning. I mean, not tidying, to keep everything. So they run. It's really about running the place, and a lot of things go along with that, obviously. So it's not just patient care, or everything that goes with it as well. Adriane, müsst ihr denn auch, verabreicht ihr viele Medikamente? Seid ihr dafür verantwortlich, ja, täglich Medikamente zu verabreichen, oder kommen da auch Ärzte? Wie macht ihr das da?
Ja, natürlich, das gehört auch dazu. Ne? Immer Dienstag werden die Medikamente für die ganze Woche schon vorbereitet. Ne? Und jeden Morgen die examinierte Kraft gibt die Bewohner die Medikamente, ne? Oder nachmittags. Ne? Und fast jede 3 Wochen haben wir die Visite von den Ärzten. Und wir sind immer in Verbindung, wenn was passiert, wenn vielleicht ein Bewohner schlecht ist oder sowas. Natürlich, wir können immer die Ärzte anrufen und um eine Visite zu bitten.
Okay. So the medication, for example, gets organized for roughly 3 weeks. All the medication gets organized so that everyone knows what they are given. They then every day, or whatever schedule the patients are on, they give them the medication, and then they have doctors that come in every 3 weeks. They re-examine and then they go away. But they're obviously in touch with the doctors on a very regular basis. If something goes wrong, if someone's not feeling well, if someone needs extra care, it's their job to contact them and make sure that they're okay. So is it your job now? Is your job now very different to the job at the elderly home before? Ist dein Job jetzt sehr anders zu deinem vorigen Arbeitgeber, zu dem Altenheim?
Ja, im Altersheim natürlich, man hat mehrere Bewohner. Ne? Zum Beispiel, wo ich früher gearbeitet habe, wir haben auf einer Etage 100 Bewohner fast. Ne? Das war 3 Wohnbereiche, aber das war viel mehr Bewohner, die wir versorgen mussten. Und natürlich, die Zeit war, wir hatten nicht so viel Zeit für jede Bewohner wie jetzt. Ne? Und aber natürlich die Pflege wurde immer gemacht, so gut wir konnten, aber natürlich der Zeitdruck war viel größer und vielleicht deswegen auch, das war einer von den Gründen, dass ich mir wo ich ein bisschen mehr Zeit habe jetzt für die Bewohner. Ne?
So I just asked her what the difference was to her previous job to her job now. She was in an elderly care home before with a lot more patients. So this one is organized differently. So she has more time per patient. The elderly care home before was in the whole home, there was up to 100, obviously also more staff, but a more time pressured job. So less time per patient. The care was similar. So doctors come in, come out, but they also deal with the medication. But one of the reasons for her that she changed after 16 years is to have more time for the patients. So yeah, that's that's different. Maybe Adriana, we can talk a little bit about your life in Germany and how you think how you found it to fit in here. Adriane, wie jetzt, ich springe noch ein bisschen mal zurück, einmal noch, als du in Deutschland angekommen bist, wie fandst du es, dich hier in Deutschland zu integrieren? Fandst du es schwer? Hast du schnell Anschluss gefunden? Oder ja, welche Teile fandst du schwierig? Was fandst du gut und was fandst du leicht? Ja, vielleicht erzählst du einfach ein bisschen
Ja,
darüber.
natürlich, jeder Anfang ist schwer, ne? Weil ich war gerade auch 20 Jahre alt und ich war sehr schüchtern. Aber man muss einfach auf die Menschen zugehen, weil in Deutschland sind nicht so offen manchmal wie andere Länder. Ne? Aber ich finde, das ist sehr, sehr wichtig, immer Kontakt zu den Deutschen zu suchen. Und am Anfang habe ich die Fehler gemacht, manchmal viele brasilianische Freunde gehabt zu haben. Dann war natürlich ein bisschen schwieriger, Deutsch zu lernen. Ne? Wichtig ist aber, dass man die deutsche Sprache hört und auch wenn man nicht richtig spricht, dass man spricht. Ne? Weil nur so kann man lernen. Und ich muss sagen, ich wohne seit schon sehr lange hier und ich wohne sehr gerne in Deutschland, weil sonst wäre ich nicht so lange hier. Ich finde, man kann sehr gut in Deutschland sich integrieren.
Sehr gut. So she's been in Germany. She came to Germany when she was 20. So yes, she said at the beginning. I mean, the beginning is always you set up, you leave, you start a new life is obviously more tricky. At the beginning, she made a lot of friends that were Brazilian, so she stuck to her own. But she said to learn German, it's very important that you integrate with Germans and locals. She said in Brazil people are more open, so it was a little bit harder. But she said Germans are very approachable, so you should approach them. They just don't look maybe as approachable. But people are very open here to speak, and once you meet a lot of Germans, it helps your German language, and it makes a big difference to feel settled here quickly. What else did you say? So yeah, she said she's been here this long because she obviously likes it a lot. She's here to stay. She feels at home here now, and yeah, so it's a good country to get integrated in. You can, yeah, it's not a difficult place to settle, but obviously important at the beginning that you do integrate yourself with the Germans and you just speak. Go for it. Don't worry about making mistakes. Just go for it.
Yes.
Are there any questions? Should we take a few questions? Do you guys want to type some questions in the chat? Whether it's about the job, whether it's about Germany or language or getting settled. You guys know where the chat.
I have one question.
Yeah, Shivai, please tell me. Tell the question.
Ma'am, I want to know about German language level now.
About German language, sorry?
German language level, ma'am.
Label?
Yeah.
What do you mean by label? The different
Level.
Levels, yes. What do you mean? What level you need?
Can you explain your question a bit more? What level are you asking about, Shivai?
Maybe you can type your question and specify a little bit more. Someone else said, "How are the people over there?" Adriane, wie findest du die Deutschen? Sind sie ja, wie soll ich das fragen? Sind sie offen? Kann man leicht Leute treffen hier? Oder wie trifft man Leute hier? Wie hast du das gemacht?
Ja, ich wollte gerade auch noch sagen, in unserem Beruf, ich hatte sehr, sehr viele ausländische Kollegen. Und die meisten Deutsche haben immer sehr, sehr viel Geduld, weil die wissen, dass die deutsche Sprache schwer ist. Ne?
Ja.
Und das war nie ein Problem. Ne? Man, wie ich schon gesagt habe, Hauptsache, man versucht sich zu verständigen. Ne? Und weil in Deutschland ist eine Multikulti-Land, sind sehr, sehr viele Nationalitäten hier. Und ich finde, wenn jemand wirklich zeigt, dass der Arbeit will, dass er Lust hat, die Kollegen und auch die Menschen draußen, die sind immer offen, um uns zu helfen, weil die wissen, dass die deutsche Sprache nicht so einfach ist am Anfang. Aber die Grammatik ist am Anfang nicht so wichtig. Hauptsache, man spricht.
Sehr gut. Ja, das ist eine sehr gute Antwort. So she said at the beginning she had a lot of she also had a lot of international colleagues. Now still does. And she said working with Germans and the internationals was always very good. The Germans are very patient when people are learning German because they're very well aware that German is a very difficult language to learn. But grammar mistakes don't matter. The important thing is that you just go for it. But she said it's very nice working with German people. They're very open to having international colleagues, so that's very good. I think someone else asked the question: Does everyone know English? A lot of Germans know English. It's a very common second language to know. So yeah, when you get stuck with German, English is a very good bet if you already know English. What else do we ask here? Okay. How many years salary? Okay, salary expectations. I think Gayatri, we can answer that on our part, right? Gayatri, maybe you can answer that question, what the salary increases that we know. So it goes from when you get here. Sorry, you're on mute, Gayatri.
Sorry. The starting salary, I think we already communicated to you during your interview process that the starting salary, if you're a nurse in Germany, is around 2,900 euros. And then it could be a little more than that as well. And of course, as you proceed, as you keep working over there, you will get promoted. I mean, your salary will be revised and it will keep increasing. So the base salary is 2,900 euros for nurses. And for truck drivers, it is 2,400 euros.
Right. So I think I hope that answers your question. Nitu, you asked after 6 months you want to find accommodation. Yeah, I can ask Adriana, I can ask you that, but I think I can also answer that for you. So there are a lot of different websites that you can go on here. Whether it's shared accommodation you're looking for or your own accommodation, there are lots and lots of different websites that you see what's available. You tend to call people then and book a viewing or have a look, and then the actual signing process is just a contract like it would be in India as well. You sign it and then relatively simple. The process of finding depends on where you are. Sometimes if you're in the big cities, Berlin, Munich, it's a bit more tricky. Sometimes it takes a little bit longer to find. But if you're in smaller cities, Nitu, you're going to Amberg, I think, it'll be very easy to find accommodation. Oder Adriane, wie hast du das gefunden, als du eine Wohnung gesucht hast am Anfang? Kannst du da irgendwie sagen, wie du das gemacht hast? Oder ich glaube, die Frage habe ich ein bisschen beantwortet jetzt schon, aber wie hast du das damals gemacht?
Ja, Wohnung ist ein großes Thema in Deutschland. In große Städte ist wirklich schwer, eine Wohnung zu finden. Ich hatte das Glück gehabt, durch Bekannten eine Wohnung zu finden. Ne? Das ist meine erste Wohnung in Deutschland und die zweite auch. Und später, ich bin jetzt 23 Jahre verheiratet. Ne? Natürlich, mein Mann ist Deutsche und dann das war seine Aufgabe. Aber Wohnungen natürlich in große Städte ist schwierig zu finden.
Yeah. Okay, so I think I more or less covered that. In big cities, it's a bit more difficult to find. In smaller places, it's easier, but it's definitely doable. So yeah, you just got it. It depends on what you're looking for. There's a lot of shared accommodation as well. If you're just looking for a room, or if it's temporary, or if you're looking for a house. Again, that's a hard question to answer across the board because it differs. If you're in Berlin, Munich, Frankfurt, Cologne, those are the big cities, it sometimes takes a little bit longer. Do all people know English? A lot of people in Germany know English, or at least some broken English, and Germans are not shy to speak English either, so they just tend to go for it. Yes, working hours. That's a very good question. Adriana, was sind deine, wie arbeitest du? Was hast du für Arbeitszeiten?
Ja, ich arbeite normalerweise eine Woche Frühdienst. Der Frühdienst beginnt um 5:45 morgens und geht bis 2:45 nachmittags. Ne? Und der Spätdienst beginnt um 14 Uhr und bei uns geht bis 22:30 Uhr. Und natürlich, man darf nicht vergessen, dass wir auch Wochenende, Feiertage arbeiten, aber dafür kriegen wir auch Zuschläge. Ne? Wenn wir einen Sonntag oder einen Feiertag arbeiten, das kommt noch dazu. Ne? Oder Nachtdienst auch. Bei uns, wir haben feste Mitarbeiter, die Nachtdienst machen. Ne? Aber jeder Haus ist anders. Ich mache keine Nachtdienst, aber da bekommt man auch tolle Zuschläge.
Okay, so that's a very good question, guys. So in where Adriana works, there are two different shifts. So there's an early shift and a late shift. The early shift goes from 6:15 to 3:15. I hope that was right. And the afternoon shift or the late shift is from 2 p.m. till 10:30 p.m. So those are the two shifts. You also have to consider that you do work holidays and weekends also, but you get additional pay for working those more difficult hours or those more sacred hours. They have a team that does the night shift, but that is a dedicated night shift team. So Adriana, for example, does not work nights. So she's come in and said she doesn't work any nights. So she does the early shift or the late shift. And the team that does the night shift always does the night shift. Adriana, wie viele Stunden arbeitest oder wie teilt sich das auf in der Woche oder im Monat? Wie kann man das sagen?
Ich glaube, ich arbeite 38 Stunden der Woche.
Okay, so a full-time job would be, so Adriana has a full-time job, so it's 38 hours a week. So it comes to, depending on when the shifts vary, obviously, but 38 hours a week. Und Adriane, wie kriegst du deinen Kalender für den Monat? Ist das jeden Monat dasselbe? Oder ist das immer mal anders? Oder dein Dienst?
Natürlich nicht, weil gibt es immer Kollegen, die vielleicht in Urlaub sind oder nicht. Und so Mitte des Monats kriegen wir den Dienstplan für den nächsten Monat, ne? Dass wir uns ein bisschen planen können. Ne? Aber ja, und jede 3 Wochen haben wir Bereitschaft. Ne?
Mhm.
Wenn jemand zum Beispiel eine Wochenende krank wird, dann wir haben eine Person schon, die Bereitschaft hat. Ne?
Ah, okay.
Und dafür kriegen wir auch etwas Geld, ne? Und natürlich die
Mhm.
Stunde, die wir arbeiten.
Yeah, okay. So you get in the middle of the month, Adriana gets her schedule for the next month. So it obviously varies a little bit every month. It's not the same, but you get 2 weeks ahead. She gets given her schedule so that she knows she can plan ahead for the next month. They also have a system in place where someone is not on call, but is ready to jump in. So is the backup in case someone gets sick or has to fall out. But it's always a dedicated person who is allocated this role, and that person would get paid extra for the hours that they cover. So, but it's not always the same person. So it's always someone else who's on cover leave. Yeah, I hope that answers the questions. Let me just, sorry, I need to go through these questions. Oh yeah, so do you have to finish okay, so the question is, once we got our job over there after B2 level, do we have to finish C1 and C2 level? It's not from our side, from a visa perspective, you do not have to. You can obviously choose to go on and do more, but as Adriana said, she came and she did 6 months of German courses, but I think what she would agree with me is that you learn best when you're surrounded by the language, when you hear the language, when you're with people who speak German. But yes, obviously up to you. If you want to go on and do more courses, that is up to you. Adriana, hast du denn, weißt du, bis welches Level du gekommen bist? Oder war es B2 Deutsch oder auf welchem
Ja,
Level warst du nach
ich
deinem
habe bis
letzten?
der B2 gemacht.
Okay,
B2.
so
Ja.
Adriana also, she completed B2, but hasn't gone any further. But as you can hear, she can speak very good German. So I think that's you don't need a certificate for that if you're there after a while. What other questions? With B1 level, can we move to Germany? So with B1 at the moment, it's not. We're working on that actually to come here, that you can come here and work on while you're learning B2. But at the moment, as it stands, you need your B2 before you can come to Germany. Because also care, hospital care or elderly care, those are jobs where you need language to communicate with the people. So at the moment, the government has said B2 is the level that you need. Once you come to Germany, are we working in hospital or home care? That depends. So when you get your A2 German exam, you will start getting interviewed. We put you in touch with both hospitals and home care, and part of it is what you've said. If you're willing to work in home care, in
கேன்டீன்ல தான் கேட்கணும்
elderly
கேன்டீன்ல
care,
தான் கேட்கணும் ரெக்வஸ்ட் பண்ணணும் ஆமா அவங்க அங்கதான் எங்களுக்கு ஃபுட்டு அண்ணா உங்களை என்ன மேம் கிட்ட பேச சொன்னோம் ஆமா செந்தில்மணி மேம் கிட்ட கேட்கணும்
Raji.
can you meet them? Hospital or home care, you'll be probably not home care, you'll be in a care home or in a hospital. Which after you reach Germany, which time of exam will they conduct in training sessions? Good question. So what the exams will be they take place in the hospitals where you're going to be working at. Is it subject based or language based? Are you talking about the nursing exam? It's subject based, but it's in German. So that's why they also require you to have B2 German, because that exam is in German. But it's also very practical. So you'll be learning where you are. Is there any exam in India
Yes,
for going
ma'am.
to Germany?
That question belongs to me. That question.
Oh yeah. Okay, go on.
I'm asking that question.
Yes.
Is it subject based or language based test in nursing profession? Related to nursing profession.
Subject. So it's about it's a practical test, but it's in German.
Okay.
The content is in German. Yeah. is there any exam in India for going to Germany for BSc nursing people who get salary? No additional exam, but you have to take your B2 German exam. So that's a Goethe test. That's the okay, and then there's another question. Do nurses have night shifts in hospital? Adriana, I don't know. Weißt du, wie das in Krankenhäusern läuft mit der Nachtschicht? Kann man sich das aussuchen, ob man Nachtschicht arbeitet oder nicht? Oder wie ist das bei euch? Würdest
Ich
du sagen,
glaube,
ich möchte Nachtschicht arbeiten oder ich nicht?
genau, ich glaube, dass wenn jemand Nachtschicht machen möchte, ne, ist immer eine Frage. Ich glaube, ne, meistens, glaube ich, gibt es das feste Personal, aber weil ich habe schon viele Kollegen gehabt, die wollten nur die Nachtschicht machen. Ne? Und ich glaube, das ist von Haus zu Haus unterschiedlich. Ne? Jeder Haus, ne? Das hängt von den Mitarbeitern, glaube ich. Ne?
So the night shifts, so Adria is saying it varies from hospital to hospital or home to home. But she said normally it's the nurse who says, yes, I want to do night shifts, or no, I don't want to do night shifts. The way it's dealt with at her institution is that the staff that does night shift only does night shift. But it could be different in other places, depending on how they deal with it. But you as a nurse need to say, yes, I'm okay with night shift, or I'm not okay with night shift. So, yeah, if you're willing to work night shift, or you want to work night shift because you get additional pay, then that's yeah, you need to say that.
We just have 4 minutes left. So if you have any question, please ask.
Okay, let me go through this quickly. The nurse in India will be counted. Yes, your experience as a nurse in India will be counted when you start working in Germany. I'm just going to fly through these. Yeah, salary is definitely experience-based. Wait, so okay, maybe this one's really quick. Adriana, letzte Frage, weil wir haben nur noch 3 Minuten und dann ist der Call schon vorbei. Aber die verschiedenen, gibt es in Deutschland die Krankenpflege ist ein allgemeines Fach, ne? Oder ist das richtig? Ist es die allgemeine Krankenpflege? Mitarbeiter, die du jetzt bei dir hast, die sind nicht spezialisiert auf Demenz oder auf Altenpflege. Das sind allgemeine Krankenpfleger. Ist das richtig?
Ja, ist das richtig, ja. Weil in Deutschland jetzt gibt es auch, früher gab es diese Kurs, alte Pflege und jetzt ist Krankenpflege, ne? Und deswegen, ja.
Yeah, so no, in Germany, the nursing profession is one job. So it's not that they are specialized in elderly care or specialized in dementia or specialized in certain areas. It is based on your experience, but it's not done by study. So you're not doing a course in elderly care or a course in dementia. It's a course in nursing, and then you specialize depending on where your experience lies. I think 2 minutes, I think we'll wrap it up. Gayatri, is that fair? Adriane, vielen Dank für deine Zeit. Ich glaube, das hat allen sehr, sehr geholfen, die vielen Fragen zu beantworten. Ich hoffe, das hat geklappt. Ja, vielen Dank nochmal. Und yeah, guys, I hope that helped. I'm sorry that was, we've got 2 more minutes, so we'll wrap it up. But I hope that helped answer some of your questions to see what it's like over here in Germany and to work here in Germany. And again, if you do have more questions, maybe I'll collect the rest of the questions and see if I can shoot them over to Adriana, and maybe we can answer them as we go along. A lot of them are also, Gayatri and I can certainly answer them. So it's always good to have these questions and hopefully help with your concerns before you go to Germany. So yeah, shoot questions over anytime.
Viel Glück an alle.
Dankeschön. So, ihr müsst Deutsch lernen. Ich hoffe, ihr habt auch was verstanden davon. Ich denke mal,
Deutschland ist ein sehr schönes Land. Kommt zu uns. Wir brauchen euch.
Thank you so much for doing this session, Ariane, and thank you so much, Nicola, for arranging this session for our nurses. Hope this was really helpful for all of that.